Last night I was at a concert and they had massive glass sculptures and there were all sorts of crazy shapes, and it reminded me of being in medical school and the pictures they took of bacteria. They were lit up and they were orange and spiky and kind of crazy, and it made me think people really are afraid of this whole flesh-eating bacteria thing, this MRSA or MRSA, thinking that somehow their immune system's going to fail. Their whole body will fall apart and they'll die. Well, there was a young lady that we spoke about before. She's done fine. She's alive. She's had some horrible things that have happened. She's lost her hand or a leg, and there's been some horrible stuff, but she's alive, thank God. That's great. What I'm concerned about is that you know that MRSA is nothing to be feared. Methicillin-resistant staph is probably more about the immune system than it is that specific bacteria. So if your immune system is strong, you should be able to fight off a nick in your skin or another problem like that. In our practice, we often use antibiotics, one called clindamycin or Cleocin, and another one which we rarely use, but it also works, called Bactrim. They're old-fashioned antibiotics and they work very well, but the important thing is to support your immune system. Number one, don't be afraid. Fear makes your immune system weak. So I want to encourage you, if you have a cut and a small infection, if you hear about MRSA or flesh-eating bacteria, number one, don't be afraid. Your body's gotten you this far. It'll probably continue. There are some other things, specifically ultraviolet blood irradiation or photoluminescent therapy, which seems to be very effective, even more effective than antibiotics in some situations, to destroy MRSA germs. Always take a high dose of vitamin C. If your doctor says it's okay, a couple grams to 4 grams a day, along with your antibiotics, usually Cleocin or Bactrim, and you should do really, really well. But number one, take a deep breath. Don't be afraid. Flesh-eating bacteria doesn't necessarily need to kill you or scare you. Always talk with your doctor. We're better together.